Assalamualaikum warahmatullahi wabarakatuh and greetings to whom that is watching my video. My name is Neurology ABDULLAH BM2411082 and I'm a first year medical student at University of Malaysia Sabah. I am here to talk about the field of medical that I am interested in and explain a little bit about it. So, I'm really interested to join the neurology field. What is neurology? Neurology is the branch of medicine that deals with the diagnosis and treatment of all categories of conditions and disease involving the nervous system, while neurologist is a physician specializing in neurology and trained to investigate, diagnose, and treat neurological disorders. I have read about some of neurologists based in Malaysia, and without doubt, they all have outstanding backgrounds. Some of the neurologists are Dr. Chris Chong, Dr. Sheila Ong Aimee, and Dr. ABDULLAH bin Yusuf Han. Moving on to the main agenda today, as we all may know, our nervous system is divided into two, which are namely the central nervous system and peripheral nervous system. I am going to touch about the central nervous system, which consists of the brain and the spinal cord. Today, I am only going to talk deeper about the brain, so I will be starting with the anatomy of the brain. The brain lies in the cranial cavity, and during development, it can be divided into 5 parts. The first part is the telencephalon, which is also known as the cerebrum. The cerebrum is the largest part of the brain that consists of 2 hemispheres, which are the left hemisphere and also the right hemisphere. It is divided into 4 lobes: the frontal lobe, parietal lobe, occipital lobe, and temporal lobe. The outer layer is called the cerebral cortex, that is made of grey matter, while the inner part contains white matter. Deep within, there are groups of grey matter that is called basal nuclei, which help control movement. The 2 hemispheres are separated by a deep fissure, and the surface has ridges, which is called gyri, and grooves, which is also known as sulci. The second part is the diencephalon. The diencephalon lies between the cerebrum and brainstem. It has 5 main parts, namely thalamus, hypothalamus, metathalamus, epithalamus, and subthalamus. The thalamus acts as a relay station for sensory signals except for smell and help regulate movement and emotions. The hypothalamus controls basic functions like heart rate, body temperature, and hormone release through the pituitary gland. It is commonly associated with homeostasis. Next, the metathalamus includes the medial and lateral geniculate bodies, which handle hearing and vision signals. The epithalamus contains the pineal gland, which helps regulate sleep and puberty, and habenula nuclei that is involved in emotional responses to smells. Finally, the subthalamus involved in motor control and is linked to the basal ganglia. The third part of the brain, mesencephalon, it is also known as the midbrain. The midbrain is the smallest part of the brainstem that is located above the pons. It includes the tectum, which is responsible for visual and auditory reflexes, and cerebral pentacles, which carry signals between the brain and the spinal cord. The midbrain also contains the substantia nigra, which helps control movement. The fourth part of the brain is called the metencephalon, which includes the pons and cerebellum. The pons, they act as a bridge between different parts of the brain and helps control breathing and sleep, while cerebellum controls balance, coordination, and fine motor skills. It connects to the brainstem through the cerebellar pentacles. The fifth part of the brain is mesencephalon, which is also known as the medulla oblongata. The medulla oblongata is the lowest part of the brainstem, connecting the brain to the spinal cord. It controls vital functions like breathing, heart rate, and swallowing. It also contains the pyramids, which help control voluntary movements and all that is involved in motor coordination. So now I am going to talk about the blood supply of the brain. The brain receives its arterial supply from 2 pairs of vessels, the vertebral and internal carotid arteries, which are interconnected in the cranial cavity to produce a cerebral arterial circle of Willis. The 2 vertebral arteries enter the cranial cavity through the foramen magnum and just inferior to the pons fuse to form the basilar artery. The 2 internal carotid arteries enter the cranial cavity through the carotid canals on either side. Now let us move on to the physiology and reaction that happens at the brain. The brain sends and receives chemical and electrical signals throughout the body. Different signals control different processes, and the brain interprets each. Some messages are kept within the brain, while others are relayed through the spine and across the body's vast network of nerves to distant extremities. To do this, the central nervous system relies on billions of neurons that produces synapses. But bear in mind, the brain does not directly produce synapses, but it enables their formation and modification through the activity of neurons and supporting cells. Synapses are the connection between neurons that allow them to communicate. These connections are formed during brain development and continue to adapt throughout life in a process called synaptogenesis. Especially in response to learning and experience, the brain's remarkable ability to remodel these connections, that is known as synaptic plasticity, involves strengthening useful synapses or eliminating unused ones. Additionally, certain brain regions like the hippocampus can generate new neurons in a process called neurogenesis, and these neurons can form new synapses. Supporting cells such as astrocytes also play a crucial role in maintaining and regulating synaptic connection. Thus, the brain facilitates the dynamic creation and adaptation of synapses, shaping its complex networks over time. So there are many related diseases that involve the brain such as stroke, multiple sclerosis, epilepsy, and Parkinson's disease. One disease that piqued my interest is the tremor, or more specifically, the essential tremor. Briefly, tremor is a type of body movement that is out of our control and looks like trembling or shakiness. It can happen in one or multiple parts of the body, and most commonly, it appears at the hand. Tremor can be divided into two types, which are the rest tremor that happens in a body part that is relaxed and completely supported against gravity, and action tremor, which happens when you are voluntarily contracting muscles in the affected body part. Essential tremor is one of the tremor syndromes, and specifically speaking, the exact cause of the disease is unknown, but it is thought to be a result of a disruption in brain's communication system. It is usually not a dangerous condition, but it typically worsens over time and can be severe in some people. Sometimes essential tremor is also confused as the Parkinson's disease. The symptoms gradually begin and usually are more noticeable on one side of the body. It worsens with movement and can include a yes or no motion of the head. Symptoms may be aggravated by emotional stress, fatigue, caffeine, or temperature extremes. Some complications of the disease are it might be difficult to hold a cup or glass without spilling, eat without shaking, and talk if the voice or tongue is affected. Essential tremor doesn't require treatment if their symptoms are mild, but they might need some discussion with the healthcare provider if things get worse. Some treatments that are available to treat essential tremor is by prescribing medicines, undergo a therapy, and doing surgery. One of the treatments that piqued my interest is doing surgery using deep brain stimulation, which is also known as the DBS surgery. DBS is a common type of surgery for essential tremor. It is generally the preferred procedure in medical centers. It involves putting a long, thin electrical probe into the portion of the brain that causes the tremor, which is also known as thalamus. A wire from the probe runs under the skin to a pacemaker-like device called neurostimulator that is implanted in the chest. This device transmits painless electrical pulses to interrupt signal from the thalamus that may be causing the tremors. Side effects of DBS can include equipment malfunction, problems with motor control, speech of balance, headaches, and weakness. Side effects often go away after some time or adjustment of the device. In conclusion, neurology is a vital field that focuses on the brain and nervous system, addressing disorders related to the system. The brain's complexity and adaptability make it fascinating to study, and treatments such as deep brain stimulation offer hope for managing neurological conditions and improving patients' quality of life. Before I end my video, these are the list of my references. That is all from me. Thank you for listening and have a good day.